Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everybody. Welcome to Digital Health Talks. This is Megan Antonelli, and I am here with Janae Sharp, and we're going to talk about 5 good things. 5 good things at ViVE, 5 good things that happened in between ViVE, and 5 things we're looking forward to at HIMSS next week at Las Vegas. Hi, Janae. How are you?
I'm great. That's a lot of good things. I'm actually looking forward to everyone tagging me online with their good things. So everyone who sees this, you can like, follow, subscribe, share your good things. Tag us, Health Impact Live, Digital Health Talks, and hashtag 5 good things. All right. Yes. What are we starting with? How was ViVE?
It was good. We missed you. We missed you a lot. They do such a great job.
It's good to know it was miserable without me.
It was. It was so sad. I couldn't drive you to the beach. I couldn't take you around and show you LA. It was just me and Andrea and 9,000 of our favorite digital health leaders. But it was good. It was great. I think they did a lot better job with the space. They had the convention center kind of set with tables in the front. So it was, you could eat and there was a big sort of connecting space even before you got into the hall, which was really nice. And you know, one of my top 5 moments was actually sitting there having lunch with Charisse and a bunch of other people, and you know, kind of just sort of saying, it kind of felt like a cafeteria lunch. Like people were just like, "Hey," jumping over. Right. I saw Johnny from Scale Health and all these folks, so it was fun. And in general, I thought, it was well attended. There were great people. There were great sessions. It felt a little smaller, but part of that, I think, was that they had condensed it to the floor and the space that they were in, because you know how last year you could go from, it was actually in both right. sides of that area. This was really all in just that one side. If there wasn't anything on the other side, I didn't go to it. So,
oops. Nobody better spoiler it for us. Just say it was on one side.
Right.
I'm sure you still got your step count in for the day.
We for sure did. But I did wear my comfortable shoes. And, it was, I think the sessions were great. I think, I saw Amy Gleason's and Anish Chopra's talk, I think, was sort of the highlight. That was sort of standing room only. Mm-hmm. And that was the first time I had actually seen her speak in public while I was in the same room.
She was actually one of the first people I saw speak in healthcare, period. A million years ago, at a patient engagement summit.
Oh, wow.
Yeah. And she was great.
Yeah. Great. And I had heard the story of her daughter and what they've gone through with that. But it was great to hear it in person and, just have her tie that personal story to the work that she's doing every day at Doge and across, HHS. So, and I think the audience response was really good. So it's exciting to see that. And certainly we'll have more of that at HIMSS with, she's going to be there and a few others from CMS and ASTP, as well as, of course, Dr. Oz. So
yeah,
I think they do. They are on the circuit and they are talking about what they're doing. So
yeah. People do really impressive work with having technology help people access better services. And just hearing about it at scale is amazing.
Mm-hmm. Yeah, for sure. And then, of course, our dinner was a highlight. We had our Health Impact dinner at Javier's, which is a new restaurant downtown. It was super fun. My highlight of that, of course, was Dr. C.T. Lin, who I've known for a few years, maybe a decade. He was definitely an early health impact speaker, and he plays the ukulele, and that is one of his passions. And he has always done some parodies. So years ago, I heard him and he did this at Health Impact. He did a parody of, I think it's Hospital Under the Rising Sun. That's about Epic. Well, so now he's got an updated one that was the Sweet Caroline to Chat GPT and it was awesome. Although our room was incredibly crowded, one, because of course we had a great group. And then it was also quite loud, louder than a private room should be. There was an anthropic reception that I think kind of dropped itself outside this area that should have been dining room, just plain dining room, and it wouldn't have been loud. But it was a very loud reception of very loud, excited people that are obviously just dripping with money. No, I don't know what they were. They were great. They were fabulous, but they were loud. They were for sure loud. And it was, but we had a great time. And that was, it was just nice to have that group there. Natera, of course, is an underwriter, and Heidi and Sale Point. So great.
Oh, Heidi, I saw a lot of their stuff online. So I was watching from North Carolina, and I loved it. I loved the pictures of, like, was it the buses or what was it? Were those Ubers, taxis? But
they did. I think
you saw
they had
it all over.
both. Are you wearing Heidi yellow? Your Heidi yellow.
Yes,
today.
I'm wearing Heidi yellow.
It was
such a happy color.
It was a yellow. And it was great. It really the branding they've done is fantastic, and they had their booth. I think wins for the most beautiful design booth. I have to give honorable mention to the EFAX booth because they had espresso martinis at 3 p.m., which is a good
love
call.
But they were thinking of everyone. Someone on their team thought about the conference.
Yes. They knew who their audience was. And then, but Heidi, not only inside with their booth, but outside, and it was really just an amazing takeover. They had their branding on the screens, and it just popped really well. It was, good job. Kudos to Leia and the team there. Good work.
I do think ViVE does a really good job with the visual aspects of an event. They haven't forgotten that things should look good.
They haven't, and they think about it a lot, right? Because it's not easy to make an ugly convention center look good. And even just get the screens in the right place and do that. There was an announcement this week that the LA Convention Center is redoing itself. So, we'll be watching that happen for the next 30 years. Maybe by the time the airport is done.
You'll be watching in the great weather. It'll be so hard for you. Go play pickleball in the meantime. Meet famous people at conferences and concerts. Maybe we should talk about this. This is a real good thing, right?
Oh, yes. Are we moving from ViVE? Wait.
Okay. I might jump the gun if you want to wrap up ViVE. No, I got a little excited.
I think that's it. We can move to my midweek. So between ViVE and HIMSS, I went to a concert.
You were like, I haven't seen enough people. I need to go to a concert.
I only saw 9,000 healthcare people. I would like to see 10,000 Brandi Carlile fans. Which I did. And newsflash, guess who is a Brandi Carlile fan?
Jane Fonda.
Noah Wiley from Pitt, from the Pitt.
Yes.
That you still haven't watched, but you need to watch.
I still haven't watched, but I do want to have him on our podcast. So this is your official invitation. I'm going to tag you. Noah Wiley, come on our thing. Let's talk about physician mental health, which is something that they talk about a lot on the show. And one of the best depictions of healthcare, according to healthcare physicians and practitioners. So that's a big deal.
It is a big deal. And what's interesting, though, is this year, even though this season, they are still focused very much on the physician and the physician's relationship with the healthcare system and the nurses and sort of the clinician system and within the system operating. But a new character would definitely be AI. So they are now featuring and talking about the AI as there's a new attending who's going to be replacing Dr. Robby while he's on leave, riding a motorcycle, possibly without a helmet, all of these things leading to what will be an unbelievable cliffhanger of a last episode, which we are not at yet. But
you're making predictions.
But the AI tool, she is a big proponent of it, and she is, sort of telling the younger doctors to use it to help with their charting. And of course, a mistake was made, and one angry doctor from upstairs comes down and says, why does it say this? And why does it say that? And we get the emphasis and the point that human in the loop is important. So it was very much, I don't like to sort of post personal stuff anywhere, let alone on LinkedIn. But it was such a coming home moment for one, the fact that we talk about the show a lot. Two, the show is very much healthcare IT focused. And three, if there ever were a doctor, who, someone who plays a doctor on TV who I would like to see as my doctor, it would be either Dr. Carter or Dr. Robby. So we're good.
You're like, I'd believe their medical advice.
I would. I trust him. I do. But he was super nice and it was super fun. And then as an added bonus, Jane Fonda was there. So it was something to be seen. And she got a standing ovation in the audience as she was sitting down among 10,000 people, which just was sort of impressive in and of itself. And of course, Brandi Carlile was also amazing and the show was good, but it was also called the Human Tour, which of course, as we're kind of grappling with all of this AI stuff in healthcare and beyond, as we're seeing,
it's everywhere.
Anthropic and OpenAI have their battles in the news and behind the scenes. The poignancy of the Human Tour certainly hit home. So, and I take that, and now we go to HIMSS, where we've got 30,000 people. I don't know what HIMSS is at, and HIMSS is running at this year, but it certainly feels like a lot. Having trolled through the app quite a bit myself to see who's there and who's coming, and I'm super
I love
impressed.
that you use every conference's app. This is something I don't know if everybody knows, because I never use them until you'd be like, well, have you looked at the app yet? And I'm like, what? People make these apps, they put so much effort into them, and then nobody looks at them, I thought. But people do look at them, turns out.
Well, sometimes people go to the conference to go to the conference.
I go to the conference for the people.
Yeah. Well, it does help you find people and where they'll be, other than relying on chance and happenstance in the halls, which also works. But I'm
the conference personality hire for HIMSS because I love them. I have a lot of excitement.
Yeah,
get to speak.
And when you are there, it is like following, a rock star around. So it's not.
I love it. I love everything. I don't
have that magnetism. I need to know where people are going to be so I can stalk them outside their session.
Maybe. But I don't know if you fangirl as hard for HIMSS as I do. I've served on the boards. We decided we were going to make things happen when everyone was despairing. And I feel like so many people have been through it. We want this conference to be the best one.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
Well, I'll tell you, I really am impressed with the content that they have in there this year. All of these conference wars could have gone one way, could have gone two ways, could have gone sideways. I really think that it is apparent to me as a conference person who puts this stuff together all the time that they are actually curating the content in a way that they haven't done that before.
That's great.
And the sessions look good and the people on them are impressive. It might not be as, keynote showy, although they have Jeremy Renner and Dr. Oz at the end, on Thursday. So those are pretty impressive keynotes, but there's no, NFL player to cap it off or whatever. But, I'm never looking for that. That doesn't get me in a room. I think Jeremy Renner has an incredible patient story that is very poignant. Who knows how he lived through that. So amazing. And so, I would certainly stay to listen to that. And then, I just think the topics in general, there's a lot of vendor talks and stuff, but they're well balanced and they're well represented with customers. And I think that's incredibly important. So it'll be exciting to see, what
are you going to? I mean, I think, that relationship where you have to use different means to get your goals met in healthcare. Like vendors are part of that. You know, they're always going to be great. And I love some of the things that happen at HIMSS. You're going to the intersystems
the parties are fun. The intersystem party. So that'll be my first time at the Sphere. So I'm very excited to go to that. I was very excited. We usually would have our dinner on Monday, but this year we're having it on Tuesday. And that means that we're free on Monday. So we are going to go to that, which is exciting.
Just for you, intersystems, because of the Sphere.
Mm-hmm. I really love InterSystems. They've been a partner of Health Impact for a long time, and they're part of the core of digital health, right? So
they've built some great things too, and they always throw a good part. They always have good food.
They do, and then
you can tell I care a lot about the food in an event. Like
the food is important, and I got to go back to ViVE. They did the trucks this time. They did it well. It was like you go up, you get your food. There were enough. They were in the right place. They were all just like right out front, and they were really good. I had a sushi burrito that still think
was good even for LA.
It was good. Well, it was LA, and it was good. Yeah. So kudos to them. That won't be the case at HIMSS. It's just not possible. You can't. Well, I suppose you could bring a food truck or two inside that hall, but they'd have to be unionized. Part of
and the food trucks. I'm kind of more excited about a food truck situation in California than I am in Vegas, to be honest. But everyone has different things.
Yeah, that's not Vegas's thing. You got to look forward to dinner at Vegas, and there will be fabulous dinners, including ours, right there. So it is, there's fun things to do inside and outside of the conference. I think last year they were using like the forum, and it was a bit spread out. I think this year it's a bit more concentrated. So hopefully that will ease things for the exhibitors as well. And I think in terms of sessions, the artificial intelligence conversations, I think I did a search. There were like 32 sessions. I mean, which frankly aren't that many, but of course I did it spelled out. So there's probably another 32 that just say AI, but you can't do AI because that exists everywhere. Right. So there's a lot on rural health, there's probably 10 or 15 sessions on that. And I think I'll probably make it to 2, but it's, I go through the app. I find 20 sessions I'm going to go to, and I go to, a smaller portion, but really good talks and a lot on, I think where I'm looking at next in terms of coverage, because there's a lot of discussion around, everybody who doesn't, they don't want point solutions. They want enterprise, they want platform, how these solutions are going to play into that, how so the point solutions are going to respond, what that means. Does it mean partnerships? Does it mean expansion of services? What is that all going to look like? And, and I think ultimately that question of what does healthcare look like in 2030 at this point, right. I think I thought I knew what it was going to look like more than I know what I think it's going to look like now, a year ago.
Yeah.
And I guess that's, not just healthcare, it's the whole world. But within healthcare, this question of which jobs stay and which jobs go and which jobs we need and what people are going to want is changing just as fast as it is outside of healthcare. Right. And so I think those conversations that maybe are a little bit theoretical, that don't necessarily impact people are becoming more important. There's always this we want to do stuff that's actionable now. But if we don't figure out what we want the system to look like now, what are we doing? We're just hamsters in a wheel, or batteries, which is what I think.
We don't need to plug everything in.
But you're not coming, and I'm sad.
I just got a book fair notice for my kid. Yeah, make sure that's in there. It's book fair season. No, I'm not. I have a family obligation. So I'll miss everyone. So everyone can post about it for me.
We will. Why don't you talk a little bit about what you've been doing with the patient AI group? Did we talk about that last week?
We did. We talked about it already, but it's still exciting.
Yeah.
I think it's exciting too, because we have this patient AI collaborative where we're talking about, what patient facing systems should look like that are using AI. And then every time you read the news, you realize how relevant it is. You read stories about people just plugging their health system, their health information into ChatGPT and getting results, but not really thinking about the long-term implications for them and not really realizing just how much those types of systems can put them at risk. So
I know every once in a while, ChatGPT will respond to me with like with a memory of something that I said to it months ago. And I'm like, wait, first of all, that wasn't about me. It was about, my son or whatever. Or second of all, like, ew, it was about me. And that's scary that you're retaining all of that. So, well, that's all the stuff that's happening in the conference world over the last and next week. What's happening outside the conference world, Janae?
Well, tons of things are happening. One of the things I was really excited about was the announcement that Anika Gardenhire is going to be the Michigan Medicine's first Chief Digital and Information Officer. And I love to see how people in medicine are preparing more for the importance of digital in general.
Well, I think this transition from CIO to CDIO is an interesting one, that they're adding digital to the CIO title quite often. It's also interesting that she's going to Michigan. If I recall, and I might be recalling incorrectly because I tend to do that, but Sue Shade was one of the first female CIOs, and she was at Michigan. And that was in, I want to say, 1999, 2001, maybe it was 2004, but it was a long time ago. And she is amazing, Sue Shade. But Annika is also amazing, and she will do amazing things there, no doubt. It'll be interesting to see. She's coming back she was on the insurance side, right? She was at Centene for a bit.
And she went to Ardent Health after that.
Ardent Health for a bit.
Back to delivery, right? Yeah. And that's interesting to see someone who's had that depth of experience across the board.
Yeah.
And also to see that they're going to be proactive about technology development with clinicians. So we'd love to see that.
Yes. Super.
There's my good news. My flowers are blooming in my yard.
Mm-hmm. Yeah, it'll be interesting to see what announcement come out of HIMSS. I think there were various product announcements. Nothing that was too earth-shattering coming out of ViVE. Things that we were excited to see, like Pothik Chatterjee, who we know when he was at LifeBridge, worked with us at Node Health. He's heading up the Houston Methodist Rice University Digital Health Institute. So a new kind of collaboration there. Lots sort of happening in Houston around digital innovation, which is cool to see. We've done health impact there quite a bit. And then one that I'm sort of excited about or always interested in is WeThings is doing a partnership with MedStar Health around their concierge medicine, and it's a tracking for blood pressure and sort of a new scale. And I've had that WeThings scale for I don't know how long, but
awesome!
Sounds like I need a new one.
Yep, you need a new one. It's great to be able to get better health data and healthcare at your house.
It sure is. Sometimes it's overwhelming, but it's good. And then I think we have some exciting things in the works in terms of the rest of our year. It's been quite the sprint from February 3rd now to March 6th. And, we'll come home March 12th. And then we just have the whole rest of the year to do some more fun health impact things. We're planning some dinners. And of course, this will be the first time we've announced our October 6th and 7th health impact in the fall. So we're excited to get planning on that. So if you are interested in being part of Digital Health Talks, we would love to interview you. If you have good things, send them to Janae. And if you are interested in being part of Health Impact, reach out. We are always looking to amplify good stories, great work, and just excited to be a part of this amazing community. Thanks for listening. And that's all for now. This is Megan Antonelli and
Janae Sharp signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.